Hi, everyone, and welcome. I'm Annalise Cothran, Executive Director of the American Institute of Dental Public Health. We appreciate you being here today for this session. This session is in meeting mode, and so we encourage folks to hang out in the chat, but we'll be saving questions until the very end as we go through today's session on understanding policy asks for veteran oral health. So today we're talking about a few things, and then hopefully, as I mentioned, leaving room for discussion. One, we'll be reviewing oral health challenges associated with veterans. Two, we'll be talking about specific policy applications that can be considered to resolve those issues. And then three, we'll talk about ways that you can be directly involved in policy change for this effort in March. As I mentioned, I'm Annalise, and I'll be presenting today with my colleague, Stacy Chazen. And we don't have bios. We do have them. I just don't have them in front of me, but I am the Executive Director of AIDPH. Stacy is the Director of Education and Leadership. And so we're here to really talk about both of those perspectives. One is AIDPH leading this effort forward. And then two, we're here to talk about advocacy. So specific advocacy asks, and also just the process of advocacy that we're offering as a framework here for veteran oral health. In case you're new to AIDPH and what we do and who we are a 501c3 nonprofit. We advance the science and education of dental public health in our communities of focus, one of those communities being veterans. And our vision is an equity-oriented oral health workforce prepared to lead. And so part of pursuing that mission is preparing oral health professionals and advocates and people around in those communities to lead through advocacy, like we'll be talking about here today. We also want to say a big thank you to our partners. One, CareQuest Institute for Oral Health, who is sponsoring the Veteran Oral Health Hill Day and all of the associated advocacy activities. So we thank them for their support. But two, we also want to recognize that we are working with a whole collection of both oral health and veteran service organization partners. And that really this path forward has been informed by the entire group of advocates working together so that voices are represented in this framework that we're offering today and the policy asks, and hopefully in the outcomes and solutions. So before I turn it over to Stacy, I want to just reiterate a couple of housekeeping things, which is number one, as I mentioned at the beginning, please save questions until the end, but feel free to chat. We have someone monitoring the chat, so we'll flag questions or comments there at the very end. Please keep yourself muted and off of video just for right now, but we welcome that in the end for discussion. And please add your personal pronouns if you're able to your Zoom display. And then lastly, as you already know, we are recording today's session. So we'll be posting that later on the AIDPH website if you'd like access to this recording. And so with that, I will turn it over to Stacy.
Great, thank you, Annalise, and hi, everyone. So we're going to start off today. We know that folks are coming to this webinar with varying degrees of knowledge about our country's veterans and the oral health challenges that they're facing. So we're going to start off with some level setting about the population and what the oral health landscape looks like for them. So who are our veterans? There are roughly 19 million individuals in the US who are considered veterans, and they make up 6% of the country's population. What do coverage and benefits look like for veterans? So some of the basics here are that the US government provides medical care to more than 9 million veterans, including those with service-connected disabilities. And you'll recognize that the 9 million is a good deal less than the total number of veterans we shared on the previous slide. And we'll talk a little bit in a moment about the distinction between those two groups. The Department of Veterans Affairs, which many of us have heard referred to as the VA, manages eligibility and benefit design for those who are eligible for benefits. And we know that nearly half of the US veteran population accesses primary care through the Veterans Health Administration. When we think about who qualifies for health coverage through the VA, there are a number of factors that determine one's priority group status. And based on what your priority group status, that determines what you have access to or what you're entitled to as a veteran. So your priority group status is dictated by your separation status, your Medicaid eligibility, whether or not you're eligible for Medicaid, what your disability status is, and that includes the extent of your disability, whether you're eligible for any other benefits, and what your income level is. These parameters for the informing factors and the priority group status are determined by elected and appointed government officials through the VA and the Department of Defense. So let's look at dental coverage for veterans specifically. We know that dental coverage through the VA is based on an individual's priority group membership, as we talked about on the previous slide, and only 15% of veterans are eligible for dental care through the VHA. Most of those 15% qualify for coverage through an eligible service-connected disability, which is defined as a physical or mental injury or condition that was incurred or aggravated in the line of military duty and that results in a disability. And we want to highlight that the service-connected disability does not have to result from combat or service that's during a period of war. One subpopulation of veterans that is an area of focus for AIDPH due to the unique challenges they face in the oral health space are veterans who reside in rural areas. And about a quarter of veterans live in rural areas, so it's a fairly significant population. These veterans are more likely to rate their dental health as poor compared to urban veterans. So 35% say it's poor compared to only 28% of non-rural veterans. They're less likely to qualify for dental care coverage through the VHA. 49% reported that they did not qualify compared to 39% of urban veterans. And rural veterans are paying higher out-of-pocket costs for dental care than those who reside in urban areas. We're sharing here the reasons that veterans are typically not getting dental care. And the number one reason that veterans have shared for why they don't access care is cost. This is the number one reason for not seeing a dentist in the past year, followed closely by lack of dental coverage as being their reason. Further, only 33% of veterans who are eligible for comprehensive dental care through the VA actually accessed a service in 2020, which the VA acknowledges as representing significant potential for growth. I'm going to turn it back to Annalise.
Thanks, Stacy. So why we're focused on veterans and why we are advocating for policy solutions, among many other solutions, is that veterans do experience what we like to talk about as disparate oral health outcomes, meaning that veterans compared to non-veterans experience poorer oral health. And really that's for a variety of reasons. When we talk about some of our research that we, AIDPH and CareQuest Institute, have invested in over the past couple of years in partnership with our veteran service organization partners like the VFW, we conducted that research because number one, there was no other data available to really understand what veterans were experiencing and why and how, so that we could then focus on solutions. And so through that 2021 research, which was fairly basic, meaning we were really just asking, do you have decay? What does it look like when you go to the dentist? How many times do you go to the dentist? The outcomes from that research were significant, and that more than half of veterans, of over 2,000 veterans surveyed, indicated that they had either active or treated decay, which was much higher than non-veterans. Similarly, we have veterans who are reporting more periodontal disease and gum problems. And then also what I think was really important to me as we look through this research is that veterans are very aware of how their oral health is impacting their overall health, and had a high level of self-awareness in such that they rated their oral health as fair or poor. And that was at 20% had rated that at fair or poor. And that was much higher than how they had rated their mental health or even their physical health. So in comparison, veterans across the board recognize that oral health is one of a pain point physically, and quite literally often a pain point, in that they are not accessing oral health effectively. They desire to have good oral health, and they are reporting significant oral health disparities. So the cost is not just physical. I mentioned pain. So having active decay can be a very painful outcome, but it can also be a very costly outcome. We know that poor oral health doesn't just stay in the mouth. The mouth is not a silo, and what happens in the mouth happens to the rest of the body. We're talking about what we call the oral systemic connection, which is just a fancy way of saying that the mouth is connected to the rest of the body. And what happens in the mouth affects your total health and vice versa. So through the course of this research, AIDPH and CareQuest Institute, we really invested a lot of time in exploring how chronic disease conditions can exacerbate poor oral health and vice versa for veterans. Through that research, we used different models to understand the cost savings associated with treating veterans with heart disease and diabetes. So one, veterans compared to non-veterans have higher rates have a higher prevalence of diabetes and heart disease compared to non-veterans, quite significantly so. And two, that makes this a priority area for engaging in ways to manage those diseases better, knowing that unmanaged heart disease and diabetes can exacerbate poor oral health, and poor oral health can make the treatment of those chronic disease conditions costly and painful. And so through the course of this work, our modeling indicates that through the veterans who are already enrolled in the VHA and are diagnosed with heart disease and diabetes, we can save about $3.4 billion per year, extending better prevention and routine oral health care to those veterans. The reason why this model results in cost savings is because what happens on the medical side results in a cost savings, or what happens on the oral health side results in a cost savings on the medical side. The VHA is the largest integrated healthcare system. And so the VHA actually has the best chance at getting those cost savings dollars by investing in an expanded model that covers oral health care for veterans with heart disease and diabetes. So much so that for every dollar spent or every dollar invested in expansion is a dollar saved for diabetes care management. And for every dollar spent is $2 saved for heart disease management. As I mentioned, the VHA, because of this highly integrated system, actually has the most to save in terms of cost and care. And in fact, when we look at the potential cost savings associated with heart disease and diabetes, and couple that with costs averted from emergency department visits, we recognize that what we could actually do is save about 2.5 times the budget of what's currently allocated for dental care through the VHA. So I believe it's about $2.6 billion right now that's budgeted for dental care through the VHA. And that combination of about $3.4 billion saved for diabetes and heart disease, coupled with about $1.7 billion saved for heart disease, creates a really good opportunity to actually save money through this investment model of expanded dental care. We put this here because I actually think it's important for us to remember that that there are people behind each one of these statistics. You know, I'm up here citing research, but the reality is we talk to veterans, we hear their stories, and the cost, yes, is significant, but not every veteran is a dollar sign. Some of these veterans are literally living on a razor's edge of being able to afford dental care and afford food or groceries. And the inadequate access to dental care that is also associated with the financial burden of trying to pay for dental care for some veterans is the difference between homelessness. And it's important for us to remember in this context that, of course, we're asking for broader dental care, but the costs for some veterans are very high for not accessing dental care or not being able to afford dental care. This is a statistic that I love to promote, and this is from our economic research brief that we released in April of last year, where we combined a few different data points, but this was actually from some market research conducted by CareQuest Institute and AIDPH, where we actually asked folks, you know, do you believe that veterans are getting dental care? Number one, do you think that veterans are getting dental care as part of customary and essential coverage? Most Americans believe that veterans were actually already getting dental care, and that was part of just the basic package of healthcare available to veterans. And that most of them believed that veterans should not be paying out of pocket for dental care. So much so that almost half of Americans said that they would pay a small increase in taxes if it meant that veterans could receive free dental care. And we bring this up to say this is a very popular solution. I think for us, we recognize that everybody has a mouth. It doesn't matter how you identify politically in any spectrum across the board. We recognize that veterans have served their country and deserve equitable and affordable oral health care. Okay, so how are we proposing that we address this problem? One of those ways is through some policy asks that we're going to review today. And part of this is tying into that Hill Day event that we're advocating for and have been promoting for the past couple of weeks. And then before we get into the policy asks, we want to kind of clarify here. We found that this is always helpful to talk about what does policy look like and what does advocacy look like. So when we talk about policy solutions, everybody has the ability to educate a lawmaker or a stakeholder about how a particular policy could benefit a population. We really define that as advocacy. So that could be making your voice heard, making your voice heard, helping a policymaker to understand a particular solution or the particular outcome of a solution that could be related to a policy, and really talking about the whole spectrum of how the policy process can improve it. It could even be pulling community members to tell their stories to policymakers so you can understand the context around a specific policy. We consider all of that to be advocacy. Lobbying is, you know, it can be connected to directly supporting a piece of legislation. And you could certainly educate around that piece of legislation, or you could say, we support this legislation, or you could say, you know, we are asking you to vote a certain way on legislation. And sometimes you have to be careful when it comes to federal funds and lobbying. We understand that some folks feel like, who may even be on this call, that lobbying isn't the place for you. And we're making this distinction because what we're offering here as this framework over the next few weeks around action in this space is that you can find a place for yourself in advocacy in this entire framework. So whether that be talking to a decision maker or a policy maker, whether that be sharing via social media about how passionately you feel about the topic, there's a place for everybody to participate in this day of action and in this educational and advocacy experience. So a little bit of background about how these policy asks came about. As I mentioned in the very beginning of this presentation, we're working very closely with veteran service organizations, and this coalition of both oral health and veteran stakeholders have really informed the policy asks that we're offering for the group today. So number one, we use some criteria about how to kind of connect these policy asks and how we landed on them, which the first criteria is, does this apply to Congress? Does Congress have a direct investment in being able to make this policy decision? So that had to be a yes for us. Two, is it timely right now? In terms of how the political process or the policy process is moving forward, is there an opportunity for us to advocate on this? And again, the answer here was yes. Number three, are they relevant to veterans? Are we ensuring that this is informed by the community with a direct benefit to the community? And then lastly, are they specific enough, these policy asks, so that a member of Congress has enough information and feels like they can move forward with making a decision or creating a solution around those policy asks? So using those criteria, we are offering 3 policy asks to all of you. And Stacey's going to talk about in just a moment what those policy asks, what we're asking in terms of a call to action. So number one, our policy ask is for comprehensive dental coverage for all veterans. So as we mentioned, and this was a call to action that we reinforced last year, we believe that all veterans deserve equitable oral health, and that the best way to get that is through the VA and through coverage, 100% coverage for all veterans. And so that's always going to be our first and foremost ask in terms of a policy solution. Our second ask is that comprehensive dental coverage should be extended to veterans with heart disease and diabetes. As we've talked about today, that's where the most cost savings can be realized, and also where the outcomes are most dire. And so focusing efforts on those 2 chronic disease conditions can make a really large difference, both in the cost and the outcomes for veterans. Lastly, we're suggesting that a study of the cost on this sort of ROI could be conducted through Congress so that we can understand really what it takes for an expansion, what cost savings could be realized, and what type of infrastructure is available for that expansion. And so with that, I'll turn it over to Stacey to go through some of our action items related to those policies.
Great, thanks, Annalise. And I want to just remind folks that we're going to have time for questions too at the end of the presentation. So thanks for holding on to those. If you are here, you are likely aware that we are having an in-person Hill Day on March 28th in Washington, D.C., which is exciting in this ongoing somewhat post-COVID era for us to be back together and doing this in person. The event is being hosted by AIDPH with its VSO partners and supported by CareQuest Institute for Oral Health. The interest form for this day, this in-person day, is closed, but if you are still interested in taking part, we're going to share some direct contact information at the end of this presentation, a way that you can reach out. We're also offering an option, and along with some tools that I'm going to describe in a moment, to support you in engaging in a virtual day of action for those who are not able to join us in person, ways that you can still reach out to your legislators and also to engage with stakeholders, whether they're individuals or organizations in your communities, states, or nationally. So first is we encourage you to engage key stakeholders. And these can be folks from veteran or oral health communities or others who have an interest in the health and well-being of veterans. There are many ways that you can do this. You can host virtual meetings with potential partners. You can draw from AIDPH's repository of tools that we're going to share, to customize tools that your stakeholders might want to use in your state or in your communities. And we'd also encourage you to reach out to stakeholders individually, either to have a virtual or an in-person meeting, whether it's over coffee, holding up your coffee mug on a Zoom call, or meeting at a local coffee shop to talk about why this is an important issue, not only to our country as a whole, but to them and their organizations as well. We also encourage you to tap into the resources on our website to create and build upon and tap into your network of advocates who are prepared to engage their own constituents around this issue. And we have a number of tools to support you in that as well. In terms of virtual action, AIDPH and our Stellar Communications team has created a number of tools that are embedded in a virtual day of action toolkit. These include guidelines and templates for emailing your legislators, ways to create social media posts, and best practices related to social media engagement. There will also be a tweet chat on March 28th at 1:00 p.m. Eastern time. And there are resources in the virtual toolkit to support you in taking part in that as well. And we also provide guidance on how you can create a video short story that you can use to get the attention of your legislators. As I mentioned earlier, if you are still interested in taking part in the in-person day of action, please email us at operations@aidph.org to let us know. For anyone who is taking part in the in-person event, we're going to be holding a follow-up webinar on March 14th at 3 p.m. Eastern time. And if you're registered for the Hill Day, you should have received an invitation to register for that webinar as well. And this will be a know before you go. We'll be talking about ways to get prepared and to support you directly in your in-person visits that day. And as I mentioned, we have a number of tools and other resources on the AIDPH website to support you in advocacy, whether it's on March 28th or any other day of the year. So with that said, I'm going to open it up for questions and also signal to any of our VSO partners who are on the call today to see if anyone has anything they'd like to add first before we move into questions. Feel free to, VSO partners, to take yourself off mute and speak up. Okay, I'm going to stop the share so we can see each other a little better.
Hey there, this is Scott. I'm in the car. I apologize for any road noise. But about the policy asks, are they 3 individual ones, or are we trying, or are we asking for all 3? Because if we ask for all comprehensive benefits for everyone, then we don't need to ask for just comprehensive benefits for cardiovascular and diabetes. Correct? Am I misunderstanding something?
Annalise, do you want to take that?
Thanks, Scott. You are not misunderstanding. If we do ask for comprehensive benefits for all veterans, then that would include veterans with heart disease and diabetes. There's just a recognition that a full comprehensive expansion would be a really large fiscal responsibility. And so in order to give different options for considerations for policymakers, we are, of course, advocating for a comprehensive dental benefit to be available to all veterans who are in the VHA. And that comes at a much higher cost than, option 2, which is veterans with heart disease and diabetes, at least recognizing the cost savings associated with that, the data that we have that really clearly indicates how we can move forward with both a cost savings and better prevention model for that demographic specifically. And then, of course, the third ask a report is a very, quote unquote, it's a much cost-effective, I guess I was going to say cheap, but it's a much more cost-effective ask, which is a report that may cost, $1 million or $2 million to really invest in the understanding of how an expansion could impact outcomes and infrastructure. So frankly, the kind of difference between the 3 asks is really big, best, somewhere in the middle, and then smallest in terms of the fiscal investment associated with all 3.
Thanks, Annalise. That's what I interpreted it as. Then really the study is the bare minimum they could do. It's maybe not phrase it that way, but then when asking politicians to act, is it like a bargaining? Do you say, okay, if you're not going to do this, do you even offer the second option, the middle best? If, or like, I don't want to start at the bottom and work our way up. I want to start at the top and work our way down, so to speak. But how do you do that from a practical standpoint?
So Scott, what I think I hear you say is, how could I approach a policymaker with this ask? And I think my response is, for those who are going to the in-person Hill Day, we'll provide scripts so that you can really get into the finer points of those asks and how to approach it. So that's kind of like that's thought number one. Thought number two about, about how to make this, I guess, more tangible to a policymaker is that our virtual toolkit for those who aren't going in person really focuses on the storytelling element, as Stacy mentioned. And I think really adding the additional context around what a comprehensive dental benefit looks like, or what an expansion could mean to people, is perhaps a way to start that conversation with a policymaker. I think the last thing we'll say is, we're always looking for bills that are being introduced to accompany some of these asks, and that the goal is that perhaps a specific bill will be offered, so that we can then say, in accompanying this policy ask, there is an associated bill, and here's what it is, and here's what it would do. And that can also give you more specific conversation topics.
Thank you.
Can I throw something in there that might be helpful? And Scott, in your question, each, this is Lindsay from Minority Vets, each lawmaker kind of has a track record or a history with how they engage with dental public health for veterans, depending, especially if you're meeting with like a member of House or Senate Veterans Affairs Committee. A lot of times, if you and Annalise and team, I'm sure you all will provide some of this like context information, but like lawmaker like Representative Julia Brownlee, who's been working on the Health Subcommittee and leads the Health Subcommittee, is going to have a more expansive understanding of why dental is necessary, and probably a more expansive view. So you would probably go in there starting with number 3, like the most expansive, and then as you kind of get a feel for their staff, you kind of change your approach. And then you're going to find other members like Representative Bergman, who would not like to expand dental, but because it's too expensive. And so you're going to kind of want to balance the history of that lawmaker versus what your asks are. And so I know I'd be happy to share, analysis if people have questions or things like that, like who might be the best for each one of these lawmakers. But really, it's going to kind of rely on what is their history, what have they done so far, have they ever said anything on veterans and dental. So I don't know if that's helpful, but each one of these lawmakers, especially the ones within the veteran space, have at some point said something about dental that can help give you clues as to which one you should really be leading with.
Thank you. Yeah, I appreciate everything, because it seems like without a specific bill to attach the ask to, then depending on who you're talking to, you might vary the ask. That totally makes sense. So thank you, everyone.
Great. Thanks, Lindsay. Other questions?
I'm also keeping Lindsay spotlighted, because as a coalition partner, and also as somebody who does lots of policy advocacy, I want to make sure that they're here, and that we can also learn from their expertise, as long as you don't mind being here on camera and a surprise session.
No, not at all. And I know you had asked some questions or said so, like from VSO partners, like what are some of the things to think about? Again, kind of Scott, going back to your thought process here about how do you talk to people. Each one of these folks also has a unique health equity lens. And so with some with some of the lawmakers within these staffers, you're going to want to be thinking about what's the case to the business case, right? How do we make sure, Annalise, you were pointing to, if we invest in dental public health, we save in other places. So for some folks, that's going to make the most sense. For other folks, they're going to understand the health equity issues. They're going to want to understand the margins. They're going to want to understand how this is a racial justice issue, how this is a social justice issue. And so knowing a little bit, and I've been doing this for a few years at this point, and sometimes I go in unprepared and sometimes I go in prepared. And let me tell you, it's always a journey when you're unprepared. Even when you are prepared, it can still be a journey. But if you don't know anything about the lawmaker, please do that research beforehand. And if you don't know what the research looks like, reach out to one of us and we can kind of talk you through what you should be looking for. But understanding what their unique viewpoint is on healthcare, on health equity, on investment for long range gain, like understanding who you're talking to long before you get there is going to be one key to success, but two, you'll know a lot more about how you should pitch the ask, and making sure that you, this is a racial justice issue when you look at the healthcare margins and who's most likely to be impacted by heart disease or varying diseases outside of dental health would be bad enough, but then you see the disparities and intersections of dental public health and the issues that are already happening. And so the same thing with LGBTQ folks. Annalise, I'm really appreciative of the work that you've done to do data on this, because there's very little data, just generally speaking, for LGBTQ veterans. They just started collecting that information in January. So the margins and understanding of LGBTQ veterans is so, we have 10 years to go before we really understand that. So I like to go in with a lot of storytelling. If you have veterans in your group, let them tell their stories. Those are always the things that those lawmakers really care about. If you have a veteran, like tell the data, tell the facts, but that story and your connection to the work that you're doing and the communities that you're serving, bringing those stories forward are what they want to know.
And I'll reinforce here too. So I know not everyone is going to be advocating in person on March 28th. So to Lindsay's point, the opportunity here to share stories with a policymaker or just your community is open to everyone. You can have impact regardless of whether you are meeting with an office that day. You have the ability through our virtual toolkit to engage with policymakers through email campaigns, through social media campaigns. We're very specifically asking folks, and if you click on the virtual toolkit link, you'll see that written many times, that we're encouraging folks not to set meetings on that day, because there will be people there in person going to meetings all day with policymakers. But what would be wonderful is for you to underscore those meetings on that day with sharing your story via email. There's templates that you can do that for, whether that be a community member who's close to you. I've heard from so many people who said, yeah, my dad, is a veteran and he had dentures at a really early age, and that's not fair. And that's why this is important to me. All of those pieces of context add support, and it in a quantitative way adds up to a policymaker, and that the more emails that they get, the more stories that they hear, it kicks it up on the priority list. So even if you don't have a specific working knowledge of what appropriations would look like or what this cost is here, you still have a story to tell. And we're trying to give you some tools and frameworks where you can find how to share that story, especially, as Lindsay points out, if you are a veteran.
Are there questions or comments from folks? Well, as you begin to prepare and you're thinking about the virtual day of action in particular, if you have any questions, please reach out to us. We're happy to provide some more support. We encourage you to visit our website to see the resources that Grace pasted into the chat in particular. And if you need any help utilizing those, again, please reach out. The operations email that we shared on the last screen, and we'll pop that into the chat as well, is the best place to do that. And you'll be connected to the right person at AIDPH who can help you. And again, if you're planning to join us in person on the 28th, please join us next Tuesday, the 14th at this same time for our Know Before You Go webinar. Grace, thanks for popping that in. Annalise, anything else before we close?
Just to thank you to everybody for coming. We appreciate your time and your energy, and we really look forward to creating some change together.
Thanks, everyone. Have a good day. Bye-bye.